What we found is over the last decade at Rhode Island Hospital, we've been noticing an increased incidence of MRSA infections. It's an infection that often involves the skin but can involve other parts of the body that seem to peak in the summer and fall months. We got together with one of our statisticians and we found, looking at a decade's worth of data, that in fact that there is significant peaks and valleys of MRSA infections that correlated with our past observations, namely summer and fall. In kids, we found there's about a 2 to 3-fold increased incidence of MRSA infections that we classified as community-associated as well as hospital-associated in the summer and fall compared to other months of the year. For adults, we found an increased incidence of MRSA infections in the summer and fall for community-associated infections. Was not as great a change as we found in the children, but we did find a significant difference. We did not find such a difference in healthcare or hospital-associated infections. What we've depicted on this figure is the community-associated MRSA infections per 1,000 emergency department visits here at Rhode Island Hospital. We've looked at that information compared to quarters of various calendar years. Each, in this case, circle or plus sign represents a quarter of the calendar year. The blue part of the graph here are for our pediatric patients going to our pediatric emergency department, and the reddish curve here with plus signs represents the adult patients coming into our adult emergency department. And what you can get a sense of here, and particularly more recently, are these dramatic peaks and valleys that actually the peaks correspond to the summer and fall months for the children as well as for the adult patients. So one might ask, what are the ramifications of our research? First of all, I think just it's fascinating information for us to think about why do these infections peak, and I think it's important then what can we do about it, and how might it affect our practice. It suggests that maybe if we have preventative strategies, just basic attention to good hygiene, that maybe those should be emphasized during these months to mitigate risk of transmission. Of course, if we understand why, I think what our research does is it sets a foundation for other future investigations to be pressed now to really tease apart the seasonality and find out exactly what the cause is. Then we can deal with something to try to mitigate the risk of transmission. We're not 100% certain of why this transmission and these infections appear to be occurring in this time of year. But it suggests that attention to basic hygiene, maybe more frequent showering during these times of year should be emphasized, particularly in kids. A lot of these infections are skin infections in pediatric patients. And is there more we could do in terms of educating kids, particularly when they come back to school, when it's still warm, but in the fall, in terms of good hygiene before you get to school each day might be emphasized. Good hand hygiene, obviously, while at school. Maybe some things we can do to try to reduce the risk of transmission and infection during these times of the year.